Everybody, welcome to AABA's webinar series. Please make sure to put your questions in the question box at any time today, and note that this is also being recorded to be watched later. You can go to the AABA website to watch the recording later. With that, I will turn it over to Christopher Lynn.
Hey everybody, thanks for joining us again for the third Hackademics webinar. My name is Christopher Lynn. I am professor of anthropology at the University of Alabama and one of the co-hosts for the Sausage of Science podcast for the Human Biology Association. So just as a little bit of background, a few years ago for that podcast, we organized a series on Hackademics, which means hacks for succeeding in academia, to explore some of the aspects of our discipline and working in an academic environment that we don't often get taught in grad school or are not learning as part of our coursework. And we had such a successful response, or such a great response to that series, that we asked many of the authors or many of the speakers for that series and some others to contribute to a special supplementary issue of American Journal of Human Biology dedicated to Hackademics. And that was successful. People loved that so much that when the AABA webinar series proposal was sent out, it was suggested that we turn the special issue into a series of webinars. So this is the third in that series of 4 webinars, maybe another one to come. This one is called The Culture Shocks of Coming Home and Communicating Across Disciplines. So we have 2 groups of great authors. We'll speak to them in concert, but to set us up a little bit, we'll start by talking to them in groups. So our first set of authors is Malika Sarma and Teresa Gildner. Malika is a postdoc at Johns Hopkins. Teresa is an assistant professor of anthropology at WashU in St. Louis, and they're co-authors, and they have several co-authors. I will let them share who they are, but they are the authors of an article called There and Back Again: The Biosocial Dynamics of Returning from the Field. Also in this webinar, we have Drs. Stephanie McClure and Ann Siebert-Kuhlman, who are the co-authors of an article called Practices of Disciplinary Symbiosis, Reblending Theory and Method, Anthropology and Public Health. Stephanie is an assistant professor of biocultural medical anthropology at the University of Alabama, and Ann is associate professor of behavioral science and health education at St. Louis University. Welcome, everybody. How are you all?
Good.
Great. Thank you.
So I also want to introduce all of our viewers to Delaney Glass, who will be co-moderating with me. Delaney is a graduate student at, oh my God, Delaney, tell me where. I don't have my cheat sheet for you.
University of Washington in Seattle.
University of Washington in Seattle. And she is one of the producers for the Sausage of Science podcast. So Delaney, would you like to get started with our first question?
Yeah, sure. So I'd love to start with Malika and Teresa. And we would love for you to tell our audience basically what inspired you to write your paper and just a brief synopsis of the paper.
Okay, I guess I can get started and then I'll hand it off to Teresa. So this paper was actually the brainchild of Augustine Fuentes at Princeton, but a couple years ago, he was actually at Notre Dame and he was the chair of our department and one of my very close advisors, mentors. He had recorded a fabulous podcast about his experience of returning from field work. And like for us, who were his graduate students, we were very fortunate. He was very, very candid and open about his difficult transition back from coming back from field work, back when he was doing his dissertation. But it was really cool to hear it from to this much larger international audience when he did his podcast. I remember it was like going on a run and like crying listening to it because it felt so important and real. And someone as fabulous as Augustine had such difficulties that it made me feel like, okay, maybe things are not that bad. So fast forward a couple of years later when the Hackademics issue came out and Augustine was asked to put together the paper, and he reached out to me and he was like, do you want to do this paper with me? Like, we can find some authors, we can create kind of like a booklet of narratives of people's experiences across the board. I've had a lot of different fieldwork experiences, some because dissertation things change, which is something we actually talk about, but also just bureaucratic issues, which is something that is also part of the problem of coming back from fieldwork. And so he asked me, like, find some people who have had interesting fieldwork experiences and let's come together. It's probably the coolest paper I've ever written because it's very different from a regular academic paper. So the way that the paper is structured is it's a set of vignettes of all of the different authors and their personal experiences of going to the field and coming back and what that transition was like. And these are authors that are across lots of different areas within human biology and anthropology, and authors that who have gone to very different places and have had really different experiences and are at different levels of seniority. So I think I'm the most junior. And so I wrote this when I was a first year postdoc. So I just finished my dissertation, I just graduated. And so all of this was really fresh and raw. And then the most senior, of course, was Augustine, who has had years to ruminate on this experience. So I just want to do a special call out to our co-authors beyond me and Teresa. There's also Michaela Howells, Shayna Levy, and Ben Trumbull. And it was amazing. And everyone has crazy stories. So I recommend for those of you who haven't read it, like just a small plug, like read the article, even if you're just reading it for the stories. And then the second part of the paper is, we came together and we're like, how do we make this situation better? My personal experience, I've seen many of my friends who have been in my cohort, friends across departments who have had horrible experiences coming back from the field. And I feel very fortunate because I had support in ways that were really, really helpful and facilitated my transition to being a postdoc and to being able to continue research. But I have a couple of close friends who left grad school because the transition was so traumatic and awful that it just wasn't worth it to continue. And so for me, that was my personal drive, because I'm like, these are fixable issues. And there's no reason why people who are brilliant and can offer so much to the field should not be able to continue a career in anthropology because they were not able to get the support that they deserve and they need. And it's not that difficult to put together. So that's just kind of
what kind of issues?
Oh, we talk about this. We talk about this in the paper, but there is a big mental shift, and I'm sure for many of you who have experienced fieldwork or just intensive research in any point, the transition of perspective and state of mind is really difficult. So you're going from being completely immersed and thinking about your research question, and then you come back and you have to deal with essentially real life again, not just real life associated with your research, but your parents and your partner and your dog, and oh, I have to pay taxes and bills and things that I didn't have to worry about when I was in the field, or I had someone else taking care of it. But then also you're dealing with all of those personal issues, and then coming back to a system that is expecting you to perform at exactly the same rate that you were always performing, and not having any sort of flexibility or compassion or support. I mean, that's the biggest thing. The entire second part of the article is all about the kinds of support that are needed and valued and are critical for success. And many institutions are just, anthropology, ecology, behavioral ecology, primatology, there's a certain set of disciplines that have fieldwork built into it, but the entire graduate program does not know how to deal with it. So things like needing extensions, needing extra grants, having counseling, mental health counseling. These are all things that are institutional changes that don't often exist and really need to exist. So, and Teresa, feel free to jump in. I have so many feelings. I'll keep talking.
That was a great overview. So thanks for taking the lead on that. The only thing I would add is that one of the reasons I was really interested when reached out to me in this is I think that the value of just normalizing these stories is, as Malika mentioned, there's a lot more attention. I mean, there could always be more, but there's a lot more attention usually focused on preparing, especially trainees, for going into the field. And so people are expecting that shift, even if they don't know exactly how it's going to play out, they're at least aware that there's probably going to be some challenges when they go into the field, especially if it's for the first time or in a new site. But then there's not that same level of attention, or really any attention in most places, on the return trip. And so I think that can be really alienating if you come out and you're struggling and you think that it's just you because it's not a topic of conversation, or you didn't have that same
preparation or any mentions of this possibility when you come out. And so that might lead to some of these issues that Malika mentioned in terms of feeling like you're not cut out for this, or you have to leave, or you don't want to go back to the field. So I think that this is hopefully going to help shift the conversation and help to normalize some of these experiences so we can talk more about it and people will know they're not alone, and that no matter what stage you're at, I think hopefully comes out across this paper, people who have a lot of field experience in different places, that there are these shared experiences still, and that no matter what stage you're at, there might be challenges that you need to address, and we should talk about that and figure out ways to deal with it. I think that's really the only thing I'd add to it. Malika's excellent overview.
Yeah, thank you both for that. That's really interesting. And for myself, I'm not doing field work at the moment, and it's really interesting to hear about all of your stories. And reading the paper was great to understand kind of that experience, and kind of building on what you both were discussing. I know, Malika, when you were talking about field work in Wyoming, and Teresa, field work in Ecuador, it at least appeared to me that you had a little bit distinct experiences. So Malika, it seemed like you were very immersed in your data collection and almost maybe wanted a break from that immersion. And Teresa, you were also immersed, right? But you were also applying for jobs while you were in the field. And you mentioned these sort of mini transitions, field work during the week, and then maybe on the weekend you're going into the big city and you're applying for jobs. And so you had this kind of break from that immersion. And I'm kind of curious if you would both kind of just speak on that a little bit more, and maybe that tension of wanting and needing the immersion in field work, but also needing breaks, and kind of what that looks like.
Teresa, you want to start? Yeah,
sure. So yeah, as you mentioned, Delaney, my vignette, I chose to focus on my last field season in Ecuador. Each field season was different and posed its own unique challenges, which maybe we can get into later. But my last field season I thought was particularly interesting because we went later than we usually do. So it was in the fall of the year that I was planning to wrap up my dissertation and defend in the spring. So it was already stressful because I was on a compressed timeline. So I needed to get these last data for my dissertation in order to defend on what I wanted to. But at the same time, I knew I'd hopefully be finishing, so I was on the market and applying for positions, and that's when a lot of these positions are coming up, or you're starting to do first round interviews. And so it's a very odd experience where when we go into Ecuador, where I work, we're typically working in communities that are pretty off the grid, so there's not phone access or computer access. So I couldn't access any of the things I needed to complete these applications or check them. So I needed to make trips back and forth from the community working at back to where I could get internet access to keep up with things. And this created a different type of field situation that I'd been in before, new stresses. So not only did I have the field work stress of trying to get these data I really needed to finish, and trying to be in that mindset of getting these data and working within the community, but then also the compounding stress of having to apply for jobs, which is its own set of issues and stressors. So those two together was really challenging, and it made it difficult to kind of transition those mindsets for being in the more like professional academic mindset versus collecting data, and in two different languages too, right? Spanish versus English. So it was just a very disruptive process. And then I think the other thing that was challenging, there are definitely benefits. So coming out regularly, I could go get a meal at a restaurant, and I could have a hot shower, which was nice. But at the same time, it was kind of one of the big things I experienced going into the field is that especially when you're off the grid for a while and you come out, is that overload of information of things you missed when you were off the grid. So news stories or things that happen with your family and your personal life back home. And so that can be a lot to process. And I think that's one of the big challenges of coming out of the field is wrapping your mind around and processing all that, especially if there's big national events or big world events that you didn't hear about that other people have had time to process. And then you're just hearing about for the first time, and they're not in the same stage as you are as you're trying to work through what happened. That can be challenging. So for me, I almost had that happen multiple times. I'd be gone for a week or two, things would happen, and then I'd come out and hear about it and have to process it while dealing with these other stressors. So that was also really disruptive too. So it was just a very unique situation to have to grapple with, and over time. Luckily, I would say for me, one of the reasons I think I was able to is I had a very supportive team, field team that was with me that I could talk to, and that really, really helped me. So relying on those networks, I think, was crucial in helping me to deal with all this and protecting my mental health and reducing stress.
So I'm going to do things a little if you guys don't mind, I'm going to do things a little differently than what we talked about and get us all involved in the conversation. So I want to ask a question of Anne and Stephanie now, so we can pull it all together. Now, one of the reasons that you were both asked to contribute is because of the dual training in public health and anthropology that we see so much in our discipline, on our side in anthropology, and we offer that here. And Delaney, I believe, is being trained in epidemiology of maternal and child health and anthropology at the same time. So we're interested in your backgrounds, and then how the way you wrote this article as a conversation was interesting. So we'd like to hear about your logic and your approach to that, if you don't mind.
Well, I can start, and then Anne, just feel free to jump in. So I approached Anne about contributing because we'd worked together at St. Louis University, and one of the things that, but we didn't get to do a lot in terms of doing research together. But whenever we had our sort of fascinating conversations, we were preparing our lunches and sort of talking in our departmental meetings about the work that we did. One of the fascinating things I found out about Anne is that she's an anthropologist on the down low, or I'd say she's an anthropologist on the down low. I don't know if she would characterize herself that way, but that she really sort of, she incorporated, she blended anthropology and public health in her work in a really effective way in her teaching and in her research, and she was sort of further along the faculty, the tenure track that I was. So it was something that I always admired about the way she was able to do that. So when I got the idea for talking about this blending, actually, Chris, I think it was your suggestion that I might talk about, my sort of straddling the two disciplines. I was like, I would like for Anne to talk about this with me. And so that's how we got to the article. And also because we'd had some philosophical conversations about sort of the role of theory and the sort of theory versus applied argument that sometimes comes up in these conversations, within anthropology and within public health, and also between the two disciplines, when people sort of give into that tendency to characterize public health as applied and anthropology as theoretical. So and we both, I understood that we both sort of felt like that was an artificial separation, and that there was value not only in both disciplinary approaches, but in the theoretical and the applied. So, and because I enjoyed our conversation so much, I was like, well, let's structure this as a conversation as opposed to a sort of a systematic investigation, and talk about our journeys, because even though we share, I think, a philosophy about that blending, we came to that through different paths. Anything to add, Anne?
I just say, when you approached me, I was on board right away, because I do think the article and the approach to the article is really just sort of an extension to our continued conversations that we'd always had. And I am jealous that Alabama stole you away, because one of the things I miss a lot in the environment is just having those types of conversations and being able to kind of process, but kind of slowly over time in sort of an evolving way, not necessarily always around a particular research project or this type of thing, but from that philosophical perspective. And so it was really fun to do this together and to have an opportunity to, I think through in a more structured and intentional way, sort of the conversation that we've been having for several years.
Delaney, do you want to?
Sorry, I was muted. Yeah, I mean, this is so interesting, and yeah, as someone who's also doing dual training, I've run into this, this false dichotomy of, theory versus applied work, and I think even, the most well-intentioned people still kind of perpetuate that idea, and I'm curious to know more about that, like, why do you think that dichotomy exists, and how do you think we can go about changing that?
Oh, that's a hard question. I mean, I think I think, at least I'll talk from the public health training perspective. I think part of it is, even within public health, and it's true in anthropology too, you've got these sub-disciplines and stuff, and people get really focused in a sub-discipline, whether it's epidemiology or statistics or behavioral science, and we don't do a good job of integrating the theory training across and kind of infusing it across all of public health. We're very focused on kind of methods and tools and sort of getting the job done without necessarily taking the time or finding the space in our curriculum to really intentionally infuse that theory. And I would say particularly theory beyond the individual level. One thing I think public health, over a course of several decades, did get engaged in kind of individual level theory of behavior and stuff. And now we're talking more and more about these social determinants, all these things, but I don't think we've done as good a job in the theory at the organizational, cultural, social levels, and definitely not from a training perspective. So then people come out, and if you're not really exposed or forced to kind of wrestle with some of that in your training, then I think you sort of, it's hard to break that mold once you're out, responsible yourself, and then you're training the next people.
That's a good point.
Yeah, and I mean, on the anthropological side, I think it's true as well, right? What students are so excited about a lot of times in anthropology is the doing, is what Malika and Teresa are talking about, is going out into the field and really, sort of getting that hands-on, that direct experience with communities and with collecting the data, right? And theory is about a learning how to think about the things it is that we do. And so in some ways it's sort of unsexy, right? It's not the hook, it's not what pulled us into the field, but it's an essential tool for us to be able to actually do what we do in the field well, right? Because bringing theory to that gives us an opportunity to sort of say, okay, so what does my discipline say about this? And in what ways is what my discipline says about whatever situation I'm entering to, in what ways is disciplinary thought consistent with what I'm finding? In what ways is it inconsistent? And particularly for people who are new in the field, it kind of gives you a little bit of a structure, right, to go in with. But the key is having that flexibility and not being bound to say, as I used to say to my behavioral science students when I taught in public health, people are not made for theory. Theory is made for people. So the idea is that it's a thinking tool, and that your engagement with communities, with people, can and should inform theory and our understanding of what it is, of the patterns in human cultures that we examine.
And if I may just bring it all together, I think that part of the reason that transitions when moving from fieldwork to being back and writing was so difficult, but for me personally, and I think this is the case for many people, is you are in the process of integrating that practice and theory together. And when you have like a dedicated time to just like hang out in the field, and you don't really have to think about any of that, you're like, okay, I'm just collecting data. I just need to make sure that my participants have snacks and everything, and they're filling out all their surveys, and we're hanging out, and they like me, and I'm integrated in the community. You're doing the practice. You're doing the practice. But then, you're doing job applications. Now you have to think about, okay, how does this fit into this bigger, larger research program? This question, like, how am I contributing to the field? How am I contributing to other fields? And I know that both me and Teresa are kind of like, we do anthropology, but we also integrate with other disciplines as well. And so like that process of like, I'm doing field work, and I know how to do field work, and I know how to collect data, but now I have to talk about it in, an anthropological theoretical framework. But I also want to talk about it in a way that is important to clinical participants or important to public health. Social determinants of health is, something we had talked about. And so that transition is something that is difficult. And I feel like, you know, we could all use more support in being able to navigate that.
That's a
And
really
I think
good.
one of,
Go ahead.
oh, go ahead. No, I was just saying, I think one of the crucial elements here is time, the time and space to think and process. And this, I don't think this is unique to public health or anthropology, but I just think the nature of academia has shifted. Kind of the speed and the pace of things and everything that you're supposed to be doing in your faculty job doesn't really allow or support as much, or is inherently without like really making the time and the space to do that processing and to have those conversations. And I think that's a challenge.
Yeah, and related to your point, Anne, and then circling back to what you said earlier, Malika, about this idea that, you know, in anthropology, because field work is an expectation, it's a rite of passage in many cases, you know, a lot of us, you know, need to do that and need support to do that, but perhaps lack institutional support. So it's an expectation, but it's maybe not a formal, you know, part of our training or part of our program. And one thing I've noticed, at least in my MPH program, is that there are aspects, you know, built into the training that are, you know, that anthropology can learn from. So for example, at least at the MPH level, there's practicums built in. There's like what you might call more applied work, but really it is field work, where you're working with community partners, you're doing research, you know, a whole host of things. And I feel like that's kind of one vein through which anthro programs could perhaps, you know, learn from public health about building a training program that is very supportive and perhaps less reliant on sort of like individuals making those things happen. And yeah, I'm just kind of curious to hear from all of you more about kind of what type of institutional support you think is needed, and kind of how public health, anthro kind of might learn from each other in that process.
So our article has a nice figure that we have all of these institutional things that we think are needed. I actually have like notes for this webinar that says like stop coming up with individual solutions for institutional problems, which I think is something that we all feel very, very deeply in this, you know, year 2 of pandemic, year 3 of pandemic. But I think that, you know, you hit it right on the nail on the head. The institutional support is absolutely critical. So like some of the things I think are probably going to have like the most, you know, bang for your buck is one is departments and programs putting money down. Like it's not just about talk or saying that there might be resources, like just give people money. Like people cannot, you know, you come back from the field and you're like trying to transition and like, you know, you need time to process, but you're not going to be worried about writing your dissertation if you like don't have enough food for groceries, or you're like arguing with admin about your fellowship status and making sure that you are getting paid enough. Even like, you know, something that our department did, so Notre Dame did this and I thought was really awesome, is they gave us money to just hang out. So it was like, you know, after, you know, all the people who had come back from the field, they're like, you know, here's a couple $100, like not that much, but you guys can just take this money and like go to a coffee shop or like get a pizza and like hang out in one of the rooms and just hang out and talk. Like you don't have the only product is that you get to hang out with each other. And that I think was really, really helpful. And knowing that like free food, you know, you get a free pizza or you get some, you know, coffees or something and you're like, I get some bagels, I don't have to pay for it. I don't have to worry about my lunch for today. I can just come into the office and just hang out and we can talk about like some crazy things that happened in the field. I think that is something that's really important. And then the other big institutional thing, you can look at the article if you want the full list, but the other thing I think would be really valuable and is important is pathways to mental health help of some kind. When I was writing up my dissertation, I joined a dissertation support group, which ended up just being group therapy, and it was amazing. Like it is the only reason I finished my dissertation during the pandemic and like got out and graduated. and it was so valuable. And it was like something, it was like a pocket of a pocket. I only found out about it because I had a friend who had heard about it from another friend, but like being very open and available and being like, this is an option and this is one way that an institution can help.
Yeah, and you kind of raise an interesting point there, you know, about support coming back from the field, but I also think even getting to the field, right, is extremely expensive. It's often relying on individuals' ability to bring in a grant. It's very competitive. So also, you know, support for individuals to even go to the field, go hang out before, you know, writing a formal grant, that kind of thing.
Yeah.
So I want to, go ahead.
Oh, I'm just going to speak a little bit to Delaney's point, not necessarily supporting people to go to the field, but the point that she was sort of raising about that preparation and, you know, what that might look like. And at the end of our article, Anne and I sort of talk about, you know, what that actually might look like. Our reviewers kind of pushed us a little bit to say, okay, now you've told us all the things that are wrong. What might be some solutions? And one of the things that we talked about, or that I talked about, well, I think we both did, was a seminar series that you might run for dual degrees programs like the one we have here in Alabama, where you would actually have a seminar in anthropology and public health that you would have community partners that you worked with to engage students in sort of that in a sort of more stepwise approach to field work, where you got to practice some of that processing and what it means to sort of build those relationships when it wasn't, you know, all or nothing, everything you've worked for the past 5 years, here it is all on the line, you got to get this right. But, you know, in a seminar that would kind of take you through it in not your field work, but a process of doing what's essentially community engaged research, so that you would have practice, right? And what it meant to go and come back, even if it was.
Can I add to that quickly? I think it's a wonderful point, and I think that there's a couple of things, getting back to Delaney's point about funding too. I think first of all, doing that type of practice early on, I think that can help you especially the trainee in a couple of ways, help you figure out how your interests and your ideas are actually going to work out, and once you apply them. So that can help you before you actually go into the field and have that added pressure to get the data and finish your project. I think that's a benefit. But then also, I think in terms of the funding and, you know, how competitive it is, having that type of experience is something you might be able to speak to when you're seeking funding, and that might help you look more competitive, or, you know, you can actually speak to your experience in a way and then strengthen your application. So I think that's a really good point. And the last point I want to make, going back to the institutional model, is I think that the funding point is really important, because I think that that's something institutions can help with. And I like Malika's point of just even smaller things like supporting graduate students or coming back from the field to get together and talk. But then even funding larger things, like we're funding collaborative projects, collaborative seminars, these things that institutions can put their money where their mouth is, people together in the room and fund that type of work. And I think that would help to instigate a lot of these new collaborations and training opportunities.
Yeah.
I have a question for everybody. It was going to be a question for Malika and Teresa, but as Anne and Stephanie talked about the way theory and method, it reminded me of how we have to often define what anthropology is in relation to sociology when we're training undergrads, and we often will do it, or at least I will often do it, by focusing on the dip they historically studied and the methods that they historically studied, with the caveat that things have changed so much and that disciplines are sharing each other's methodologies. So I want to push back on this rite of passage of fieldwork a little bit. It sounds rather traumatic, and it sounds like there's only one path to anthropology. And I wonder if there is an opportunity for alternatives to fieldwork for people who want to come into anthropology.
Okay, so I have been thinking about this question, like Delaney, since Delaney, you sent out the questions, and I was like, oh man, it's a great question. So something that I felt very strongly about adding into our piece, and I remember Augustine and I going back and forth about this, is about like what is fieldwork, right? What counts as fieldwork? And as someone who is from a population that has been historically studied as a subject, it is something that I have thought about deeply. And I've spent many hours, angrily railing in my advisor's office about how I wasn't getting grants the ways that I was because I'm a brown woman going and studying white people. And people are like, that's not anthropology. Like, what are you doing? But my perspective on it is that anthropology is a state of mind. Like when you're going out and doing field work, it is a perspective that you're taking to understand your question, to understand that community, to understand that context. If you're looking at, your environmental shifts of individual bodies in a particular context, like that, it doesn't matter where you are. It matters on how you are approaching the question. And so, I have so many friends and colleagues that are indigenous and going back to their own communities. That doesn't make their fieldwork any less valid. They are still doing fieldwork. Fieldwork is less about where you go and how you do it. And so, like, the pandemic has drastically shifted what is considered fieldwork. Like, there are people who are doing all of their fieldwork online. Like, they're having, community partners who are collecting their data. They're having people do surveys. Like, it doesn't make it any less of fieldwork because, again, this is my personal opinion. I think that fieldwork is a perspective and a state of mind. And so I think that's also important because, like, when I did my dissertation fieldwork, I had been doing fieldwork in international extreme environments, like super remote, I'm in the field. And then my next set of fieldwork, I was like in Wyoming. Like if I needed to, I could drive down to Denver and go and hang out at Starbucks. Like it was not that big of a deal, like location wise, but it was still a very intense experience because being in the field is still being in the field. It doesn't matter if you're like 15 minutes from your house, or even if you're doing fieldwork within your own hometown. It is a different way of thinking, a different way of engaging with the world, and that shift is going to happen regardless. So that is my soapbox.
Well, I appreciate what you say about the state of mind and thinking about kind of your perspective and tying that into what Stephanie was saying about community engaged work, right? Because I think we use different language and different terminology in different disciplines. Like in public health, we don't talk about field work. That's a very anthropological term. That's something that you don't hear in a lot of other disciplines. And yet, the process and the thinking, and even if it's just with a local, nonprofit organization or community that you're working with, you're right, it's the same sort of mentality and thinking, or at least we need to approach it. We don't always, and particularly, I think we need to do a better job training our students to be prepared, as Stephanie was saying. So I do think that thinking of it not as much about location and more about perspective and mentality and process is really important, and that's something that I think the disciplines can really share and build upon.
Yeah, I'm really struck by your comment, Malika, brown person studying white people, right? We don't often get to have conversations about those dynamics, right? So when we talk about anthropology, we always have to talk about its colonial history of white people helping the colonial government study the brown people that they were trying to civilize, quote unquote, for those who aren't looking at my air quote fingers, right? So, and Anne, your comment is pretty much, your response hits home in a way that I suspected was true, which is we fetishize the field and field work a little bit, and or at least I see it that way. So what you're saying is research is absolutely necessary in both disciplines, right? Is that what yeah. So we need to be training our students to do some type of research. And I guess what I'm hung up on is this idea of the field and our history of it. Sounds like we have to send people off someplace. And Teresa and Malika's paper and some of the anecdotes are a little bit traumatic, right? And I hear what you're saying about providing support for them, like a day for all the students to go and talk. And I wonder if you could speak. Well, let me ask Anne, public health. What sort of and Stephanie, what sort of let me ask this in a different way. My wife is a psychoanalytically trained therapist, and they have supervision and I asked this of Rebecca Lester in the first webinar, they actually do their own, basically, they have a person who's trained who does therapy with them, because when they do therapy with others, they have transference and countertransference. We in anthropology also take on, and I think that's what we're talking about, we come back from the field, we take on emotions of our field site. And we have, to my knowledge, no way to discharge or deal with those emotions. I'm wondering if public health has a systematic way of addressing what Adam Johnson called the trauma and sometimes of even the classroom, because school shootings or field work in really heavy locations. Like I don't know that we systematically address that in anthropology. At least I know we don't here. What about public health or other disciplines?
Stephanie, I'll let you chime in too, but I think no, absolutely not in public health. And this, I think, gets again to what Stephanie was saying about her, in public health, we refer a lot to community engagement and in community engaged work or research and that type of thing. And it might just be, in your own backyard, but in some ways it is still that same, but we don't do, and we need to do a better job, both on the preparation end, but then where a lot of this conversation has centered around the processing on kind of the back end or the during end. I mean, I don't think it's necessarily just after, but there's a lot of processing in the during as well.
Right, and getting back to our article's title around reblending, there's also kind of an interim step. So Chris, you talked about both disciplines being engaged in research, and that's true, but what anthropology brings to public health is that idea of intimacy, of that kind of deep knowing that can really be valuable if you're talking about medical anthropology and you're talking about sort of community health kind of issues, and looking at structures as well as individuals. That kind of deep knowing that anthropology brings can be really valuable. Now, what we're talking about in terms of coming back is like, well, then how do you process? How do you step back from that and then start to process like what you need to process to be this professional in the discipline? And again, I would agree with what everyone at Health has said, is that we need to do a better job in both disciplines of both preparing students and then helping them come back, right? And figuring out what that means to come back so that you could go again in a healthy way, if you're going to continue to work in the field. So I think you make an interesting point about the fetishization of field work, but I'm not actually necessarily on board with kind of chucking the intimacy and the sort of deep knowledge of self, as well as the community that you work with when you go and do field work. The question is, are we prepared when we go? And then do we give ourselves the time to kind of process that when we come back? And I think the answers in order are not always and almost never.
Yeah.
Say that last part again. Stephanie, I'm sorry.
I said the answers are not always and almost never. So we don't always prepare ourselves well to go to the field, right? And I think, almost never give ourselves the opportunity to actually process what we've experienced and what that means for us as human beings, as well as for our findings when we come back. Because the pressure is on to write it up, get it out, get to the next. So what Malika would do.
I just want to linger on one of the last points you made, Stephanie, about, the intimacy and kind of what anthropology brings to other fields, right? I would love, because all of you are very experienced and, whether you've been doing community work, field work, etc., I would love to know, and I'm sure our audience would love to know as well, like what's like one thing that you learned about yourself from that kind of deep knowledge or from that deep experience, whether it's in field work or your tridisciplinary trainings or dual disciplinary trainings.
Teresa, do you want to start?
Sure. So I think it's going to be a personal answer for everybody, since we all come with different perspectives and different personalities and backgrounds when you go into the field, no matter where the field is. I think I really appreciate those points about how fieldwork being a state of mind. I completely agree with that. But at least for me personally, I would say my first field season, my first trip to Ecuador, was actually my first time out of the country. So that was one, perspective, or that was one shift that I had to deal with. And then also I hadn't really gone camping or anything when I was growing up. And so going from that experience to going out of the country for the first time and then spending multiple weeks camping in the Amazon jungle was a whole different level of integration into the field setting. So I would say for me, I had to make a lot of personal adjustments in my expectations. And I'm a person who very much likes lists and structure and things to go according to plan. And I quickly learned personally that that's just not what's going to happen in the field. And that was really hard for me to overcome at first. And I'm still grappling with that. But I think in a way that this is a benefit to fieldwork, because I think that experience really helped me adjust my expectations as a trainee, and some realize these things about myself that I hadn't had a chance to grapple with before. And so it's helped me outside too, at coming back and working through that and applying those lessons in my life outside of the field as well. So personal example, but I'm sure other people probably didn't encounter those same types of issues.
I like that example a lot, and as you're saying that, I'm thinking, I have always wondered this in training students. When students come along and I find them inflexible, or I don't find them meticulous enough, and I'm often struck, I wonder if there are certain personality types for certain disciplines. And this is not a real question, because I don't actually think that that's true. I just wanted to put the thought out there. But it relates to one of the questions we prepared, which was for Stephanie and Anne, which is, why is public health seen as essential and anthropology seen as optional? And I wonder if there is any relationship to sort of what personalities are attracted to each one. And would we even agree that public health is seen as essential and anthropology is seen as optional?
So as Delaney was asking the question, the word that came up in my mind was indulgent. And I feel like that potentially answers your question, Chris. So I know that when I decided that I wanted to do anthropology as an undergrad, my dad, who I think is actually on this call right now, but my dad was not super thrilled. He's like, why can't you be a physician? Like, we came to this country to give you academic opportunities. Like, why can't you be a doctor and help people? And the idea was that anthropologists don't help people. What you go is you go and you extract knowledge for your own understanding, and then you like revel in the other, and then you write about it, and it gets like locked up in a way that is not accessible to anyone else. And what I learned personally was, and I really struggled with that, because I'm like, am I a bad person because I'm choosing to be an anthropologist and not choosing to be a medical doctor or a nurse or like a civil engineer or something that has like tangible outcomes to help other people. And I think that is like this general perception that anthropologists don't give back and they don't help, which is categorically false. The information that we collect and that we disseminate, it is our responsibility to use that to help our communities, to change the conversation of theory, to change the conversation of what is happening out in the world, to be, not everyone is going to be a Margaret Mead and be like the public face of anthropology, but because of that deep knowledge and deep learning that we have special access to, and we have training and opportunities to engage with, we should be giving back and sharing that. And I think that like anthropology has a bad rap. We have a bad reputation. And it's, I feel like the work that's been happening in the past couple of decades is really trying to shift that and change that, but we can be doing a lot better. And I think that's why people see public health is like, public health is helping, therefore it is essential. What is anthropology doing? And we have to show that we are doing stuff too.
And I want you to answer this one, because I think your work is a wonderful demonstration of how that reduction of essential versus indulgent is not true.
Yeah, I mean, when I was jotting down notes for related to this question, I mean, I put those terms essential and indulgent kind of in quotes because I think it really is perspective. And I think it's interesting, Malika, to hear your story about, you know, why wasn't I a doctor kind of thing, because in public health, you actually find a lot of students come to us who initially were thinking that they were going to be a physician or nurse or something like that, and then realizing that that direct clinical track is not for them, but kind of how else can I help or do things or be involved in this field. And so in some ways, you know, you ended up in anthropology that way, but it's also the same path that a lot of people end up in public health. And I do think it is about kind of the perspective that you want to take in terms of, you know, using your skills to make a difference. And I don't know, I really struggle with that personally, because in my head I'm like, no, no, no. But I know that there is sort of this public perception. I think all this is in the context of the pandemic, where the public perception of public health has gone through a roller coaster over 2 years. You know, what people thought about and knew or didn't know about public health before the pandemic. Then we went on this like great awareness of, you know, the roles and skills and stuff of public health. And then in some ways, at least for part of society, we've sort of tanked in terms of what public health does and what our roles and responsibilities are. So I will say it has been that perception and like what other people outside the field think of public health has been a wild ride over the past 2 years.
Yeah, and I would add to that if you've ever been on the side of, if you've ever sort of been engaged in a process in which public health was not maybe doing so well, right? Then you would question that sort of that equation of public health as essential and anthropology as optional, especially if the ways in which public health was maybe not doing so well had to do with a set of assumptions coming in about what the best way to solve a problem was, or
your audio cut out, Stephanie.
it's not working. I'm now I'm unmuted. Yes. Okay, sorry. So it's if you've ever been in a situation where you've observed, you know, public health not working, then you would question that idea, that, you know, that essential versus optional or indulgent idea. And to just give a quick example, because I was kind of going on a bit. So I'm involved in a project called Communivacs, and our charge was to help ensure equitable distribution of the COVID-19 vaccine in communities of color, and we're 6 sites around the country. But essentially, one of the issues that came up here in Alabama and in other places that Communivacs did its work goes directly to why that blending of anthropology and public health is really important. Because if you have vaccine that you're delivering in a way that doesn't work for the people who need to access it, it doesn't matter if you're doing the real stuff, because the real stuff's not getting to the people who need it. So having those conversations, those investigations, knowing the community, having that intimate knowledge and studying the context in which the vaccine is taken up, those kinds of anthropological investigations are really, really important to effective public health on the ground.
Yeah. And I think too often public health realizes that too late, right? Like they don't think about it as, and this is a very broad generalization, obviously, of kind of a whole discipline, but don't necessarily think about it up front. And it's when we get stuck and things don't work, and then we're like, oh, wait, what happened? Why did this? Oh, okay, wait a second, we need this, and I think that's a problem. I think Stephanie included a quote in the paper from someone who was a epidemiologist and anthropologist who had a career at CDC, and I love it about how essentially like the public health folks call in the anthropologists when they realize they've kind of messed things up, and instead of thinking about it from the get-go of like, oh wait, we really, and I think there's a shift that more and more folks in the field, in the discipline of public health, are starting to have that recognition and doing a better job. But I think historically, and still, too many times, we end up in that very situation that Stephanie described.
I have a question for Malika, right? You did your research in Wyoming. Were you by yourself?
I was by myself.
And Teresa, the one you talked about in Ecuador, you were part of a team, I think?
Yeah.
Yeah. I wonder, if we can talk, my impression of public health is that much of it is done team-based. So correct me if I'm wrong, but I wonder if we could talk a little bit about the pros and cons of team sort of oriented research versus the sort of lone ethnographer model that Malika seems to have done, but in Wyoming.
Yeah. So my other field seasons, I have worked with teams, and thank God I did, because I think I would have died if I had not. I have worked in the Republic of Congo with the Bayaka community, and have worked in Nepal with the ethnically Tibetan community with E.A. Quinn and Lee Gedler and Adam Boyette. All those are two different research teams, but I had people when I went, and I had research assistants, and it was, like, again, I would have literally died if I had gone by myself. Those are not environments that I was familiar with, and like I spoke the language very, very little, and so it was necessary, absolutely necessary, to have a team. Because my work was domestic in Wyoming, I just went by myself, and I had one of my collaborators was a member of the education program at the National Outdoor Leadership School. So that was like an existing entity that I worked with, and they had structure and they had students, and so like I didn't have to worry about a lot of the administrative stuff. I was just doing the research, and I hired a research assistant who was a local there, and she was awesome. And she helped a lot with, like, this is what the landscape is. She was an instructor for Knowles, so she knew a lot of this stuff. I will never, ever, ever again do a research project by myself. It is awful. It's a lot of responsibility on one person. If something goes wrong, it all falls on your own head. I have a very particular perspective because I'm a human biologist, and so like my work is, yeah, I can interview people, I can do surveys, but like I'm collecting saliva samples. I have to go find nitrogen and like put the saliva samples in there and make sure that like, there's pickups and drop-offs, and I can get things to a freezer. And if I'm collecting blood spots, I need to make sure that I have a lab area set up and have like a sharps container. Like there's a lot of logistics that having multiple people is really important. I was also just really lonely. I was like super, super lonely. I had no one to talk to. I, would message my advisor, but I'm time zones, and, he had classes, and I'd message some of my friends, but, they can only help so much. So, I mean, I think personally, as a human biologist, that the lone ethnographer model should die. I don't think it works, especially when you have to collect physical things and transport those physical things. It becomes really, really difficult. And if you are not at your, if you aren't functioning at your top notch, you are going to lose data. Like you're not going to go do a good job in your data collection. And so you are setting yourself up for not a good time. So that's my take on it.
Yeah, I can add, because I haven't done the lone ethnographer on myself. I mean, the Schwar Health and Life History Project, which is where I've done most of my field work, the structure there works fairly well in terms of it's almost like a training model to kind of get back to what we were saying about getting experience. So you have grad students that are ranged at different levels, and so you come in and start, and the first year or two, you're usually just helping more senior people with their projects. Which first of all helps them in getting the data they need to finish the dissertation, but also helps you when you're starting out to really get your feet on the ground and learn the community, learn what the interests are, what might work, what your participants are interested in, so you can develop a impactful project. And I would say that similar to Malika, we're often collecting a range of biomarkers, so dried blood spots, saliva. I collect fecal samples to look for parasites, which the community is really interested in. So that would not be possible, or it would not be possible at the same level if it was just one person doing it. But by having a team, I think it helps that we can give the community what they're looking for in terms of the level of engagement and the types of measures that they would like us to collect and that they're interested in. And so and you could have more participants. When we go into community, we don't want to exclude anyone. So we want everybody who wants to participate to be able to and have that opportunity. And I would not be able to do that on my own. So I think so adding on to Malika said, I think having the team in that type of situation is really important. And also just to bounce ideas off of. So I guess to go back to these earlier conversations about applied and theory, if you're working through and processing things during data collection, it can be helpful to have other people who are in your field to talk to about what you're seeing and to help you make adjustments on the go, and to think more about the theory and about the applications of what you're seeing on the ground. So I agree with Malika.
I also just want to, like, what Teresa said, something that I just reminded me of something else that Anne had mentioned about time. You know, the graduate programs now, like my program was 5 years, and it was like 5 years and then you're done. There's no more funding. Like now I'm hearing that some of the other students could have applied for a 6th year, but it's like you got to get done in 5 years. So if you have anything that goes wrong and you have not been going to the same field season, you don't have a lot of time with your community. And so to be a person to just come in, waltz into a community and be like, I have 3 months, tell me everything about yourself. Like, not only is that not feasible, it's also disrespectful to that community. And like, I'm really lucky that when I did field work, Kara Akabak, who was also on my dissertation committee, had worked with that same group 5 years prior. And so we had a continued communication with them. And so it wasn't like I was just like a random person coming in, but it's like so much about what we do in both anthropology and public health is about respect. And so we want to be respectful. And so part of that is like giving them the time that that community deserves. And so having people and having kind of a history of people is part of that.
Yeah, I'd say, sorry, just to add on, I think that that's so important to bring up, just having that track record of trust to show that you're not just coming and extracting and then never coming back, that you actually want to build a partnership and you're going to follow up on what you say and come back and share your results and work to collect new data that they want and do follow-up work that they're interested in. And so that's so important. And that requires time, and that can be hard to do just as a graduate student. So having these built-in infrastructures that you can contribute to is so important.
And Delaney, I know you had a comment, but I'm curious, Anne and Stephanie, I'm interested in your experiences as well. I think I just cut you off, Anne. I apologize.
Well, I was going to say, again, listening to Teresa talk about that, about building the relationship with community, providing the feedback and stuff. I mean, from anthropology, talk about that from a fieldwork perspective, but that's the very same stuff that we talk about with community engaged research in public health. And making sure that, something I'm always harking on students at either the master's or the doctoral level is making sure that you're building in the time and the resources to be able to do those steps, right? It's not just about collecting data and getting out. It's about, what is the feedback loop? What's the dissemination? What's the process for that? And so I think it's, some of these very same issues, just maybe just kind of different language around which the disciplines tend to. And, students, particularly the master's students, they complain about how much group work there is in the program. But I tell them, that's part of your training too, right? Like I've never done a project entirely on my own since I finished my dissertation. Like my dissertation, the only thing that I've pretty much done entirely on my own, and that's because for logistical reasons I changed topics and all this kind of stuff, but because I had a time pressure. But that process, and I tell them, I say, sometimes I get to choose who I work with. In this case, like when Stephanie approached me about this project and stuff, but then there's other times where my boss tells me, oh, you got to do this with these individuals. And so learning to work on a team, I think, is also part of the training process, and something that we need to be intentional about. And the students are like, oh, more group work, why am I doing that? But we don't just like sometimes we don't do a great job kind of preparing students for the work, or we also don't do a great job of like preparing them of how to work in a team and how to resolve conflict within that team, and kind of set those values of how you're going to be working with community members and that type of thing. I think that's an area that we definitely need to improve upon.
Stephanie, I wonder if you have anything to add. I know your pre-Communivex fieldwork with adolescent girls probably involved lots of moving parts.
It did, and it was definitely the lone anthropologist model. So I've done both. I've done work with teams, and I've done the lone anthropologist work. And I have to say that I actually like working in teams better, although it has its own challenges, that whole working together, resolving conflicts, figuring out how to work with people that you didn't necessarily pick and may not necessarily sort of get along with, right? Or who wouldn't have been your pick. That's all part of it, because when you go to the field or to your research site or to the community, whatever you want to say, you have to do that same sort of thing. You're not going to love everybody, in the group that you encounter and with whom you want to explore your research questions. So that part of sort of management of relationship dynamics is a big part of things. But everybody has said pretty much everything about that, I think.
I wonder if coming home from the field, sorry, Delaney.
Fine.
I wonder if coming home from the field is harder when you've been doing it by yourself and absolutely everything is on you, and it's still on you even when you leave. Like, you're still the one who has to continue to maintain all those contacts, make sure they get everything you said you were going to give them. And when you're a team, you get to distribute that. Any thoughts on that?
I'd say not just beyond that, that if you have a team, you have people who want to, at least a similar experience to you, that you can talk to and you get back and draw on for support if you're still processing things. But then yes, for the logistical reasons you list as well, I think that's also a benefit.
I'm gonna be embarrassing myself and being very honest here. I'm still working on getting my dissertation papers out because I graduated in the pandemic and I'm like, I need to just get out and have a job, please. And so I had written my chapters, but I'm writing my dissertation papers while I'm doing my postdoc. My postdoc is not in anthropology. I'm in the Center for Hearing and Balance. I'm doing completely different work. And so the amount of energy, intellectual energy to shift to go back to getting my dissertation work and then also doing these new projects that I have an obligation to get done is really, really hard. But it's on me. I'm the only one who was there. I'm the only one who has experienced it. I have to get those papers out. And because it was in the United States and it was with a community that I still engage with, I see those people. They're like, so when are the papers coming out? I'm like, it's coming, it's happening, it's happening. But it's, I will get them out, but it's so much additional stress that is unnecessary. If I had a team, there'd be more people working on it, it would be fine. But my co-authors can only help so much because I was the one who did all the work, so.
Yeah, I was just gonna circle back and just say that I totally relate to everything everyone's been saying about this, I guess, this dichotomy between the lone ethnographer and teamwork. And in my case, and I think there's a few of us human biologists in this case, but we're not lone ethnographers, we're sort of like lone lab researchers. And in my dissertation work, I'm using secondary data and archived samples from 2 field sites, one in Jordan and one in Argentina. And there were a lot of factors that contributed to my decision to do that type of work, both, COVID considerations and otherwise. And I find that, being in the lab for hours and hours and hours, doing assays, it's very lonely. And it's not the same, right, as doing field work or even doing some kind of teamwork where you're talking to other people regularly and you're engaging in a community effort or something like that. And at the same time, obviously I'm collaborating with people who've done all of the work to collect all of this data in the past and to use that data. So it's kind of nice because it's sort of, you know, the best of both worlds, getting that team experience and getting that teamwork dynamic, but then also kind of having the independent aspect of it. And I'll just say that because I chose to do a dual program, the MPH has kind of been a breath of fresh air in terms of being able to diversify my experiences. And I just wanted to highlight that for, you know, maybe early career and or graduate students who are thinking about dual training. It can give you a lot of skills in unexpected ways and opportunities in unexpected ways. So for example, as I mentioned earlier, you know, like doing a practicum, doing a community-based experience, like for me, because I've kind of shifted and had to pivot to very theoretical, very lab-based research, you know, the kind of practical hands-on field work, you know, mixed methods type of experiences that I'm getting in the MPH are actually really valuable. And I keep telling people, like, when I'm done with my dissertation, I'm just going to want to like go and interview a bunch of people because I'm doing so much quantitative and lab-based work right now. So I just wanted to kind of, I guess, harken back to some of the points that you made and highlight that the dual training or beyond dual training can be really, really valuable, especially at the graduate level.
So what I'm hearing is we all prefer team-based work over lone ethnographer kind of approaches. We all value research experiences as critical training opportunities, and then ongoing work that we do to be able to have something to apply. And we have Malika reminding us not to put the onus of changing the world on the individuals, but to look to the institutions that we're all part of and to see what sort of programs, classes, whatever we can develop. So I wonder if in the last few minutes here, we can sort of revisit some of those suggestions for our listeners to be able to implement in their own institutions. Some of those may be for grad students who may be looking for certain things at a school they're applying to, and some of them may be for faculty like some of us who are currently being reminded that we should be doing some things to support our students, but we may not know where to start. So what are some of the suggestions you guys wrote about that you would want to remind people we could be doing?
So I have our article pulled up, and I'm just going to read off of our chart, and then if anyone wants, Teresa, if you want to like expand. So we had two sections. We had one section that's like for the researcher, for the individual, and they are to create a support system, give yourself space and time, both. Like we talk also a lot about like physical space, like get out. Like I'm going to, you know, I did field work in Nepal, and then I am going to have to go back to Indiana, but I'm going to go spend a week in, you know, camping in Michigan. It's like a liminal space to kind of like process and chill out, also time and space together. And the third one is like preparing for the return, like knowing that it's going to be difficult, making sure that you're giving yourself the resources you know that you're going to need. So those are the things for the individual, but those are all extras, and what is foundational is what the institution and what the department can do. And so we had suggested as a group, one was financial and infrastructural support for social gatherings, workshops, and resources. So like the whole full gambit of like casual to formal, everything. And it's not just for, you know, not necessarily just for the individuals. We had talked about, you know, perhaps having workshops for spouses or families of people, because like that's a difficult, you know, you come back, you haven't seen your significant other in a very long time, and now you're like, oh, like I had this really transformative experience and I want to talk about it, but you don't get it, and you're like, what am I supposed to get from Trader Joe's today? And you're like, why are you talking about that right now? That's not important to me. So like having those kinds of workshops, not just for yourself, but for your community also is helpful. And then we had said offer flexible timelines. Again, the current system for graduate school and even postdocs, and I'm sure even early career faculty is tight. Like you are just gunning and trying to get as much stuff done, but that's just like not reasonable with the kind of work that we do. And then the last thing, and I think we've touched on this, is including the back again process into training and into the formal structure of PhD training, like if we're talking PhD training, including that in their master's training, if you're having people go out or do like intensive projects, but just recognize that it's a thing and that it needs to be addressed. Teresa, is there anything I missed? Oh, no.
Sorry, the wrong button. No, I think that was great. I think the only thing I would add is that we elaborate this on the end of the piece where talk about kind of the caveat with acknowledging privilege and how certain people might have an easier time transitioning back, and that needs to be acknowledged, including especially at the institutional level. And so, you know, some people, depending on level of resources and relationships they have when they come back, it might be, even though it'll still be an adjustment, it might be easier if they have a good social support network, if they have the socioeconomic resources that they need to get the help they need or to ease that transition. And so acknowledging this variation when people are transitioning back and then adjusting the level of support that's needed is a really important consideration. And then it's going to will hopefully help in the long run in terms of diversifying the field and helping people to be successful in their field work. And then the final thing I would add to that, that goes back to kind of conversation earlier about the expanding level of or definitions of what field work is I think that at the institutional level, it's important to recognize too, and as the pandemic ends, I think, you know, hopefully they will continue to have this flexibility of what fieldwork looks like, whether it's virtual versus going in person, whether that's internationally or locally, and how that can also support people of different backgrounds, you know, so people who have family obligations, financial constraints, health concerns, or safety considerations if they're not comfortable being in a certain field setting for whatever reason, that expanding this definition can help to support different models of field work and help people to succeed in anthropology going forward. And so that's also important, hopefully, to carry forward as we transition out of the pandemic.
And interdisciplinary communication, how do we make that work? Anne and Stephanie?
You don't ask very complicated questions, do you, Chris?
No.
So, I mean, in the article, you know, what we talked about was really the challenge of it. The seminar was one of our suggestions for how you might, you know, how you might try to sort of address that challenge and stepping people through that sort of interdisciplinarity in practice so that they get to actually put it to work instead of just talking about it. We also talked about faculty sort of taking time, and this is on the individual level, so you know, to make sure that they actually sort of explore the other discipline, because it is the case in universities. If you're in academia, you kind of have to pick, right? You pick a department. I'm in anthropology now. I was in public health, but to make sure that you kind of keep your hand in with the complementary discipline, so that you can help to model for students what it's like to sort of manage those dual interests, and also sort of speak to students' interests and encourage them to kind of explore outside of what it is that your department does. And my memory's failing me. Can you help?
Well, and I think beyond that individual for ourselves and keeping, you know, our hands in different pots, our eyes and ears open, we have a responsibility from a mentorship perspective to really engage with our students, to challenge them, to get, you know, encourage them to take electives outside of the department or the school. Like, we don't do that very much. Like, we give our students a list of elective options and they're all within our college, and if they want to find something else out, you know, it's really on them. I think we as mentors need to recognize, acknowledge, kind of own this issue and take that responsibility, because you know, the lovely thing about grad school is it's that time to explore, it's that opportunity. And if you're not exposed to any of that, then I think it's a challenge to incorporate it into your career later. And so to really be the ones to say, like, hey, have you thought about this? What about that? Have you looked over here? Hey, I saw that, you know, this department's having this seminar, why don't you go? That type of stuff, and really to kind of build that in more intentionally.
So I want to wrap up by refreshing your memory about some choice quotes that y'all dropped while we were going through there. I got 3 from Stephanie. So Stephanie's a quote machine. She says, people are not made for theory, theory's made for people. She also referenced anthropology being really good at deep knowing. I'm still trying to figure out how I can translate that so that I can share my deep knowledge of something with the rest of the world. A lot of the stuff that we try to do happens not always and almost never, right? So we have these best practices in mind, and we do these webinars. And what I'm gonna challenge all of us and our listeners to do is to try to implement one of the things that we said today. If we do one, that's better than none, and we make some progress. And Malika's quote that I got was negative, but I want to put it up there as a challenge. If her father's watching, Malika does help people, right? Anthropologists do help people. If there is a perception out there that we don't, and that we're pointy-headed theorists, then we have an opportunity, especially now. I think our relevance has been demonstrated, but we have more work to do to demonstrate that, both to our students and to the world. And I think that the combinations of disciplines and the boundary crossing that we're talking about today is really important for us to remember, because when we're teaching, our students can't often figure out why anthropology and sociology and public health and all these other disciplines basically all sound like they're the same thing, and how are they different, and why is that meaningful? We have 10 minutes, but we can wrap if we're done. Does anybody have any parting comments or any important sage messages they would like to impart on the world? This is being recorded forever and ever. No pressure.
Okay, one thing, and I'm surprised that we actually didn't get to it, but part of our talk was about like what it's like to adjust back and kind of be back into being a scholar. But one of the biggest things that I personally came out of my fieldwork experience and my academic experience, and I feel like the existential crisis that has been this pandemic, is realizing that, like, in order for me to do good work and meaningful work and helpful work, like, I also have to be a person. And so, like, work is not everything. And especially when you're in the field, it feels like this is your entire life, this is your entire world. But, like, have hobbies and, like, don't work extra hours that you don't need to, and, like, watch television. Like, if you need to watch a bunch of Netflix and you want to watch, like, the entire, this entire series of The Expanse that just finished, like, go do that. Go chill. Go be a person, because you cannot do good people-based work if you yourself are not a person. So that is my parting thought.
Exactly right. Like, actually, I just written down, be gentle to self, like, from coming out of the field. I think it's one of the things that our stories were all so different, but I feel like that's one of the things that we all came to, was this need to be gentle to yourself and to listen to yourself and your body as you adjust out of the field, or out of any difficult academic research experience, and just taking the time for yourself, the space for yourself, because both mentally, the need to decompress and to process, but even just physically. I mean, we didn't talk much about the physical, but that was something else that came up in our stories over and over again, is just the physical changes that happen while you're in the field, especially if you're gone for a long period of time, and how that can be challenging, adjusting back. And so just really taking care of yourself and giving you that time and space before you jump back into full-fledged work to really recover. And in the long run, that will help you, because you'll be recharged and be ready to dive back into data analysis and produce better work.
You just made me remember that I have horrible jet lag. And people give me a break when I tell them how bad my jet lag is, and then I came back from the far edge of the time zone. That I work on either edge of the international time zone, so whichever direction I go is really, really long. But when I go one way, I'm adjusting okay, but when I come back, it kills me. Everybody is sympathetic to the physical, but the emotional and psychological, not so much. And I'm as guilty as anyone. When my students come back, I'm like, okay, yeah, that's nice, but really, can we not start class and start writing that paper, right? Like, no, right? So, it's like the rest of our culture, I think. We are okay with having physical ailments and going to the doctor, but with psychological and emotional ones, there's still some stigma there, and I think it applies to our discipline too. Yay, stigma. All right, something else to overcome. Thank you all so much. This has been wonderful.
Yeah, thank you all so much.
Happy Friday. Go be
Thank
kind
you
to
for
yourself.
hosting it.
Watch some Netflix and chill, and not in that
Oh
way.
yeah. I'm gonna go
All
eat
right.
some cake. It's gonna be great.